Shitty.
So we were discussing divorce rates and if women were happier with or without men, but in my opinion, I believe that they are much happier with men because we are crazy and it's important to make people feel in love, and so I think that we came up to that conclusion. So, good morning everyone. Today is a new episode of What Would You Do? Today I was the victim, so I hope you enjoy, and don't forget, first of all, please subscribe to our Academy Yacht page on YouTube, okay? So we have a lot of content regarding implant dentistry, prosthodontics, ortho, whatever. So feel free to join us in this community. Okay, so just some spinning stuff, and please join us on YouTube. Join us. But today I feel that this case is a very special one, because when we always make this quiz on YouTube, I always feel that at least one or two of the opinions that we place, all people see and they believe, well, this is not for sure, so I'm not going to do this one. And I believe that actually the three of these, they are good answers, and of course that we had to choose one of these, but even though this is how we felt, I believe that all the others have some interesting facts, and I was very curious to understand what you at home felt was the best option for this type of procedure. So we have here the podium, and the third place we had 12% of people decided that the best approach would be for an early and delayed implant placement. In second place we had the provisional crown, where 40% of people decided that it would be interesting to do this type of treatment. And in first place we have the customized healing abutment. And this was very interesting for me because I think this was related regarding the info that I gave about the patient. So we know that it's a female patient with 45 years old. She has a maintained vertical dimension. She is a non-smoker. And the other fact that was curious for me to place here is that maybe some people, they think that this is more in terms of surgical aspect, but actually, at least in my opinion, I believe that it's very crucial for us to understand what is the prosthodontist going to do after we place the implant. So here we have 369 Huntsville's units. As you know, this is regarding the density of the bone that we have available at the place that we are going to place an implant. So here we have the panoramic X-ray. I forgot just a very small detail that we were discussing in the morning. So the tooth that we were talking about is tooth number 24, okay? And maybe you weren't able to see this. You thought it was the wisdom tooth. Okay, I think, well, it wasn't the wisdom tooth. Here actually was the first premolar, okay? Here we have also in terms of the CBCT, and I wanted to highlight here that for us to do here new endo treatment, it was a bit, it was impossible because there was actually a vertical fracture here, as you can see. So here we had to focus on an approach that was based in placing an implant, okay? So the first option that we had was taking tooth extraction. So we have to take out the tooth. Then after some months or days, we would place an implant, and some months later, we would place a definitive crown. So many people, they decided that this was the best approach. And before we do this, it's important for us to understand that nowadays we have 4 types of implant placement. The immediate implant placement that we have at day 0, okay? Then we have type 2 and type 3 that it's regarding early implant placement, where the difference between them is that the first one, the type 2, is regarding soft tissue healing, okay? And the third one is regarding partial bone healing. And the last one, the late implant placement, is after usually 6 months, okay? So what would be the advantages of us placing a tooth after 4 to 8 weeks of extraction? So the first one would be that we have a soft tissue that will heal spontaneously, and we have additional 3 to 5 millimeters of keratinized tissue. Another thing that is going to happen is that this spontaneous healing will often occur in the thin facial bone wall. Another thing that is important is that we have new bone formation that will take place at the apical portion, and if we have a patient that has an apical or a acute or a chronic infection, this is a very interesting method for us to consider. But then we can also wait 12 to 16 weeks, and we know that there's going to be a slightly prolonged socket healing period, okay? This is ideal for places that we know that we won't have enough primer stability, and it's ideal for multi-rooted teeth, for example, in the mandibular first molars. Nowadays, we know that patients, they demand immediacy and they want to have a tooth right away. So many times we don't suggest placing an implant after 6 months of healing, but sometimes this has to be done. For example, in young adolescent patients, in patients that are pregnant, patients who, for example, are not living currently in the place that we practice, and for example, when we have very large apical bone lesions. The ITI, the International Team for Implantology, strongly recommends that if we do this, we should also graft the place that we extracted the tooth, because this is going to make a reduce of the range alteration and also in terms of atrophy. So this was the first option that we had, but as you can realize, this wasn't the one that we decided to choose. Second option that we had, where we have only 2 appointments. The first one, we extract the tooth, we place an implant, and we also do a provisional crown. And second appointment, where we have the placement of the definitive crown. For this one, I'm going to talk about this paper. It's from the ITI consensus that was actually in Lisbon last year. This was the group 5 regarding implant placement and loading protocol. So if you want to take a look, it's a very interesting article because you have many questions and you have many bullet points explaining actually what you should do and what you shouldn't do. So, if you want to place an implant and then you want to do a provisional crown, there are some ideal conditions that you want to consider. The first one is that you need healthy teeth, healthy adjacent teeth, okay? You also need to have an intact facial bone, no acute infections. You have to be able to plan your crown in a 3D perspective, and also you have to anticipate and understand if you have enough stability or not when you place the implant. Actually, this last topic was one of the crucial ones when we decided here not to place a provisional crown, because in this case, as you can see, we placed a ceramic implant, and according to the recent evidence, we still need to answer some questions and understand if ceramic implants are ready for this type of cases. Another question that we had in the paper that I was referring, and I thought it was interesting for me to show you, is this one that we have here. So what steps should be taken for connection of the provisional crown to the implant? And often when I read this paper, I was actually listening in my head to Dr. João Borges and Dr. João Chen, always telling me that be careful, you need to polish the surface in the provisional. When we are taking photos, I always see Dr. Chen who's taking a photo and he says, no, this is not well polished. Let's go again to the lab. So this paper actually highlights some crucial aspects. So the first one is that screw retain is very recommended, okay? We have to see the emergency profile and have to see if it's not over or under contour, okay? Time frame is also crucial. Once again, you need a highly polished surface on the provisional, okay? Also, in terms of occlusal scheme, you have to see if you have any eccentric contacts, and also it's highlighted that you need to have a light proximal contacts, okay? So, taking into account these points, we now talk about the option that we discussed, that we decided here at the clinic, and it was that we had the tooth extracted, okay? We placed the implant, and then we had a customized healing abutment, okay? But before I show you some pictures and explain what we did, I wanted to highlight the second edition of the Implantology Master Beginners, okay? So if you want to learn more about these techniques, if you want to learn with us and you're still a bit confused on how to approach your implant cases, come and join us, okay? It will be a wonderful time here. So let's move on to what we actually did. So, first of all, you have to extract the tooth. And the extraction is a very interesting part because you need to do this in a minimal traumatic way, okay? I often hear to some colleagues saying that they can do this in an atraumatic way, but once you're extracting a tooth, it cannot be an atraumatic, okay? It's a surgical procedure, so you gotta be very smooth in the way that you're extracting the tooth. Of course, it's advised to do a flapless procedure, okay, in order to preserve bone and soft tissues. And also, you need to do the debridement of the socket and clean very well to be able to understand that there are no bacteria inside, okay? So, once again, these two photos, this was shown on the YouTube, and then this was after, okay? Then, in this case, we used a surgical guide, okay? Of course, that you can choose if you want to do a pilot drilling protocol, if you want to do a fully guided protocol. You have to keep in mind, of course, that in terms of deviations, this is slightly different, okay? After you have a crucial part here, as you can say, I was going to ask how many millimeters would be, but I forgot to cover this first. But it's important that you have a facial gap that should be ideally around 2 millimeters, okay? This is at the level of the implant shoulder. And sometimes this is not possible because of the anatomy of the socket, because of the diameter of the implant, but you gotta always plan your implant according to this measure, okay? Then we have the implant placement. We have to do then the intraoral scanner, okay, with the scan body. And then one of my favorite parts, that it's placing a customized healing abutment, okay? So according to the latest evidence, we have articles from Gary Finelli, also from Franz Lambert, that they say that they concluded that the proximal and buccal vertical bone changes remain very stable when we use this type of devices, and also that you have a more pronounced bone remodeling when it's around the implants that were placed in the maxilla. So in this specific case, I took this photo. It was in the day of the surgery, okay? Also, the articles that I was saying, the Gary Finell article suggests that when we are using tissue level and bone level implants, they have a very similar remodeling pattern, okay? And also alveolar changes occur mostly at the first year after the surgical procedure, okay? So then, after some weeks of healing, we have here a photo, okay? So, as you can see, the contour is well preserved, okay? We have there also the CBCT of this case. And after it, we do again another impression, and then we place the definitive crown. I don't remember after how many weeks we placed it, okay? Here is the CBCT image, and also we have the periapical here. I just realized that I don't have the final photo of the definitive crown, but sure, I'll give it to you guys later. But I hope you enjoyed this episode of What Would You Do? And thank you very much for your attention.